Hi, family. I welcome you to this lesson. We look at nursing care plan. All right. I cannot cover the nursing care plan in isolation without necessarily looking at the nursing process. And to fully understand this lesson, it's also important that we also have a lookup on the data that you get during assessment in order for you to come up with the nursing care plan. And that is the subjective data and the objective data. You cannot completely understand the nursing care plan without full knowledge or division of adjectives and adverbs. To write the nursing care, you also need to know the activities of daily living because they help us or constitute problems that you may identify in a patient. And sometimes the problems that we identify in a patient may come from the body systems that have been affected. All right. So to start this lesson, let's look at the nursing process and what it is. The nursing process is a deliberate problem-solving approach for meeting a person's healthcare and nursing needs. Although a lot of authors have come up with different steps on how the nursing process is supposed to be written, you will notice that words like assessment, diagnosis, planning, implementation, and evaluation, they come out strongly. And it's important that you understand these terminologies very well for what they mean. So when you say assessment, that is the systematic collection of data to determine the patient's health status and identify an actual or potential health problem. The analysis of data is included as part of the assessment for those who wish to emphasize its importance. And analysis may be identified as a separate step in the nursing process by other authors. All right. Now, let's also look at diagnosis. What is a diagnosis? Please, there's what we call the doctor's diagnosis, which is malaria, diabetes, and the likes. Now, here we're looking at the nursing diagnosis. What is a nursing diagnosis? Okay, so when you look at the nursing diagnosis, the construction, the doctor may have one diagnosis, but the construction of the nursing diagnosis constitutes a lot of problems that might have been identified in the patient. So when you talk about the diagnosis, there is identification of the following types of patient problems. The nursing diagnosis, which is actual or potential health problems that can be managed by independent nursing intervention. And we also have collaborative problems, but certain physiological complications that nurses monitor to detect or that is changes in patient's health status. Nurses manage collaborative problems using physician prescribed and nursing prescribed interventions to minimize the complication of the events. So that is about the diagnosis. The nursing diagnosis needs to be based on the problem that the patient is facing. All right, let's look at the other item, which is the third line, is planning. What is planning? Planning, when talking about the nursing process, we are looking at just the development of goals and outcomes, as well as a plan of care that is designed to assist the patient in resolving the diagnosed problems and achieving the identified goals and desired outcomes. When you see in our nursing care plan table that you have written, there is no planning, we have just put objectives. Okay, that is the planning part of the nursing care plan itself. All right. Apart from that, there is implementation. Implementation is the actualization of the plan of care through nursing intervention. And when you look at our nursing care plan there, we have nursing intervention, and then we have rationale, which has been written as RAT, nursing intervention also written in short form. Then the last part there, which is the fifth step of the nursing process, is evaluation. When you say evaluation, this is the determination of patient responses to the nursing interventions and the extent to which the outcomes have been achieved. I hope that is clear. But otherwise, there are many different ways in which we would define the nursing process. I, for one, I look at it as a systematic approach or a systematic and organized method of planning and providing quality and individualized nursing care. Others may look at it as synonymous with problem-solving approach that directs the nurse and the client to determine the need of using care, to plan and implement the care and evaluate the results. Others may look at it as a goal-oriented, organized and systematic humanistic care for patients and effective provision of nursing care. Those are the many assumptions or ways in which people may look at the nursing process. All right, so with that said, I'll move on and maybe necessarily talk about the diagram of the human being that I've written there behind on the board. If you analyze the board, I've written a human being and I've written certain things like anxiety, okay, social, skin, cognitive, nutrition, okay, communication, breathing, and the likes. I looked at this as a simple way of form of trying to portray the problems that the patient may face so that I make it easier for you to understand. Most of the problems that the patient may face, if you look at my corner there, I've put strands FBICA. So maybe social, may have to do with the skin. Okay, so there I've just tried to simplify or condense the problems, bubbles around the patient there. So all in all these things that I've tried to put around this patient, they are coming from activities of daily living, breathing, eating, and the way systems might be affected. Which systems? Cardiovascular or the digestive system. So the strands FBI CA is actually more of an acronym of all those problems around the patient. The social, communication, and then you see that I've also put R, which has also been represented within the bubbles that the patient has in the diagram. Inside nutrition and the ace of the skin or the social part, and then other starts to do with the way the risks or the risk or relations that the patient may have. And then we have the CA there, FBICA to denote fluid breathing, immunity, and the likes. But I hope you analyzed the board and you know you have understood what this is all about. So whenever you are thinking of writing the problems that the patient is facing, look at the strands FBICA. This is the CA that will help you to understand or come up with quickly problems that you're going to write within the nursing care plan. Of course, that is dependent on the diagnosis of the patient. But otherwise, because of that, there is also a pattern that you can still look at. The pattern here of coming up with the nursing diagnosis are PE, RM, BC squared, and K. So in this pattern, I'm trying to build up for a formula that I've tried to propose within this presentation on how best you can write a nursing care plan. So P there is for perceiving. Okay, so perceiving, E is for exchange, R is for relating, M is for movement, D is for valuing, C is for communication and choosing. That is for C, is for communication and choosing too, and then N is for knowing. These values, when someone has been admitted, they are affected, and it makes it easier for you to come up with problems. Maybe let me just give you a little bit of examples under the same values and how they can be affected. So under the pattern, under the pattern of exchanging imbalanced nutrition, okay, risk of imbalanced nutrition, risk for infection, risk for imbalanced body temperature, ineffective thermoregulation, that is to do with exchange. And then if we have to look at communication, impaired verbal communication, that is a problem that you can have. And to do with relation, we can have social isolation, impaired social interaction, risk for loneliness, and ineffective low performance, or impaired parenting. Those can be some of the problems that can come under relating. Under valuing, there is risk of spiritual distress, readiness, or that is readiness for enhanced spiritual well-being or spiritual distress that may come. I can imagine, because of my religious beliefs, Then I'm admitted in a hospital where they serve me pork, and I don't eat pork. They serve me beef, and I don't eat beef because of those religious beliefs. So you should know that there are also values that can be affected, and that constitutes a problem. Okay, then under choice or choosing, we have ineffective coping, impaired adjustment, defensive coping or effective denial, disabled family coping. So those have to do with choices or choosing. All right, and then apart from that, we have the pattern to do with the movement. That is impaired physical mobility, risk of peripheral neurovascular dysfunction, impaired walking, impaired wheelchair mobility, or impaired transfer mobility. All right, if you look at the pattern of all these problems that I've tried to identify you under the PAM BCK, you see that there are certain qualifier weights that have been used. And I want to give you a glimpse actually of certain qualifier weights that you can constantly use when you're coming up with a nursing care plan. What would be those? And how does it simplify your writing of nursing care plan? So qualifier words that are added to a diagnosis label or problem statement to gain additional meaning may include words like deficient. So the word deficiency will mean inadequate in amount, quality, degree, or insufficient or incomplete. Then we have words like impaired, which means made worse, weakened, damaged, reduced, or deteriorated. Words like decrease are also used to mean lesser in size, amount, or degree. Words like ineffective are also used to mean not producing the desired effect. So those are some of the qualifier words that you can use in order to qualify your problem very well. You look at the babbling under that human being we wrote there, and then you also use those qualifier words. You look at the activities of daily living, and then you use those qualifier words based on what has been affected within the patient. Look at the body system, see what has been affected, then you use those qualifier words. With that, I know you saw that I've wrote the word adjectives and adverbs there. Most of the English that we write in do with the nursing care plan, a lot of people argue to say it's not correct English. And I'm also thinking of recording lessons to do with nursing English. Adjectives are necessarily words that define or give more meaning to a noun or a pronoun. And when we talk of a proverb, it's so an adverb. It gives meaning, more meaning to a verb and also to an adjective. And these lessons can be learned in the lessons that I'm going to post to do with the nursing English. Okay, so it is mostly the problem, or why people find problem with this is mostly the syntax. Oh, when I use the word syntax, I mean just a fancy way to mean the combination of words. That is what is wrong in most cases. So with that said, let's also look at the nursing care plan that we have tried to draw there. This nursing care plan, I came up with it on the 9th of January 2020. And we have, the problem I identified was that was a 02. Of course, that's the time when I was developing this, that's the time when I was developing this lesson. That's when I was recording this lesson. And then we have the nursing problem. We have the nursing problem. Okay, so the nursing problem there is impaired breathing. The word impaired is being used to define or give more meaning to what is happening to breathing or the process of breathing. Impaired breathing. The word breathing can also be replaced by the words gaseous or gas exchange. Impaired gaseous exchange. Ineffective gaseous exchange. Okay, that is to do with the nursing problem. So now we have to look at the nursing diagnosis. And there's a formula actually now for this. We are coming up with a formula to write the nursing diagnosis. So in my formula for writing the nursing diagnosis, I just have the PE. and the PES. So you may say the nursing diagnosis may have two parts or may have three parts. P for the problem, E for the etiology. And then when it's PES, S will be for the symptom. So when you say PE, when you're writing the etiology, you write due to or related to. Then you're giving us the etiology. The etiology, once name just means the cause. And then when you're writing the symptom, you give us the evidence. The evidence will be that symptom or the sign and symptoms that you're saying. So that's the definition. So that now constitutes the three parts of the nursing process. Okay, so our problem was impaired breathing. So even when you're now writing the diagnosis, first you have to write the problem, impaired breathing. After you write the problem there, impaired breathing, then this impaired breathing, it's related to or due to what? It's related to increased bronchial secretion. Are you able to see the bronchial secretions? No. What is the evidence? Increased mucus production. We are seeing it in productive cough. This patient has impaired breathing. How do we know that the breathing is impaired? Mostly the patient is using accessory muscles. Patient is using accessory muscles, that will be a sign that there is an impairment in the breathing. All right. Then there's also some arguments that sometimes people bring across to say we have actual and potential problems. So when you say risk of there can be no evidence, okay, you risk getting malaria. You risk suffering from malaria. The evidence is you not using a mosquito net, not using a repellent and the likes. You risk dying in an accident. Why do you risk dying in an accident? Because of overspeeding. You risk getting caught. Why? Because of acting on the other side of the law. All right. So now, I do not want you to perceive things the way I see them. Whenever you have a risk, then there is no evidence. If that's the way you want it to get it, okay. But I just wanted to put my way of thinking across. When there's risk, there's no evidence. Or when there's risk, is there evidence? We can debate on and on and on. Okay? So when you say there's a risk, just give us the etiology. When you say it's a potential problem, then give us the evidence. It is okay. There's no problem with that. All right. Then, if you're good at writing nursing problem, and now you're also now feel comfortable at writing the nursing diagnosis, then we have to look at the objective. The objective needs to talk about the problem that you have, but now we are looking at the certain action that will help improve at the problem that we have. So we are saying is to increase tissue oxygenation. Tissue oxygenation helps to solve the problem of an impairment in breathing. And if the patient is not breathing well for a long time, then we can easily lose the patient. So we need a time frame. Hence, our objectives needs to be smart, but be specific, measurable, achievable, realistic, and it should be time bound. So within 30 minutes, we want to increase tissue perfusion. All right, so that is our objective there. Then we can now look at the nursing intervention. The nursing interventions here that we have is to give oxygen to the patient, the required liters of oxygen, because that improves perfusion. The evidence of poor oxygen perfusion may also be the cyanosis in the pelvic release. So we can improve, but otherwise we have a lot of equipment that we can use to monitor oxygen perfusion. Then the other thing here is that the patient should be put in balanced position if it can be tolerated, because it helps in maximum lung expansion. You can see that when I was giving you the nursing intervention, I was also putting the rationale here. And we have a column for rationale. You can have a lot of intervention, but yet have just one rationale. So mostly in my writing of nursing care plan, I try to merge nursing intervention with rationale. All right, then the next part there is evaluation. What are we trying to evaluate? You are trying to evaluate whether the objective has been met. What is our objective? To increase oxygen diffusion. And when talking about evaluation, it can be formative or summative. Summative at the end, formative within the program or within the process. So now we want to see what has come out after all our intervention, meaning we want to look at our summative evaluation. So it's going to be in past tense because the problem has been solved. Our objective was to increase oxygenation within 30 minutes. Hence, if that is achieved, the patient will start breathing normally. So patient will start breathing normally. You can also give us with respiration of what are the normal ranges for respiration? 18 to 22 or 18 to 24. You can give us that range there. Because you're evaluating and now you're giving us the parameter or the principal indicator of why you feel that has been satisfied. Okay, all right. The other part necessarily that when I started this lesson about the nursing care plan that I did not necessarily expand on do with the nursing process are the steps. Because these steps are translated within this nursing care plan. Assessment. When are you doing assessment? You are doing assessment to come up with a problem. You are doing assessment to come up with a diagnosis. So we have assessment. During assessment, you can get subjective and objective data. Okay? All right. Then there's planning. After planning, you come up with objectives. So we have the objectives here in our nursing care plan. Okay? Then you would have seen that we have 4 steps, 5 steps, 6 steps, and 7 steps, 8 steps. I don't know which generation you're living in. But otherwise, mostly we look at 5 and 6 steps of the nursing care plan. So there is APIE, that is assessment, planning, in planning, intervention, and evaluation, or ADPI, assessment, diagnosis, planning, intervention, and evaluation. And then we have also, you can also look at the planning process or the nursing process, ADOPI, that is assessment, planning, outcome identification, assessment, diagnosis, outcome identification, planning, intervention, and evaluation. I said others to emphasize on assessment, they may split it. So it will be assessment analysis, and then you add in all those. And remember, in nursing, we have a saying, if it is not documented, then it has not been done. So others, they also try to add documentation within the nursing process. But I just want you to remember the 5 steps there, or the 6 steps, that is ADPI or ADOPI within the nursing process, in case you face that question. Okay, I hope this discussion has been fruitful in helping you to understand the nursing care plan. Remember, get the subjective data, know the stem of the question, know the condition that you're looking at, and then identify the problems. When you have identified the problem, write the problems that you have identified, and then start putting them on the nursing care plan. Then that way you're going to help the patient, and the nursing care will be superb. All right, so it's the year of the nurse, 2020. It's my small way of giving out to people out there so that they understand some of these lessons that we may have been finding challenges with. So I encourage you to share so that a lot of people can learn something from this, if at all you have benefited. I'm encouraging feedback so that the next lessons can improve on these lessons that we are recording now. These videos are created so that we assist visual learners understand the lessons that may be difficult to understand when you just read them information within the books. And I'm encouraging you to say, after the recording of this lesson, check out on my Facebook page. I post the notes of each and every discussion that I have with you on our YouTube channel. So you check out those notes on John's Muna. I have a lot of pages there where I post the notes. You can check out these notes and they'll give you a deeper understanding of each and every topic that we have been covering. I thank you most sincerely and continue supporting us by subscribing and sharing these lessons. Otherwise, ciao.